Hello everyone, I am Joshua O. Fortuna and may I ask you a question? Do you check yourselves? Do you often feel like you're seeing something or talking to someone or something that you feel like it's talking back to you? If yes, let's talk about it. Welcome to the topic Schizophrenia, together with my fellow groups, Ken Seaton and Jeneline Ganda. Let's proceed to the video.
Schizophrenia is a serious mental illness that significantly affects how a person thinks, feels, and behaves. It can lead to a disconnect from reality, characterized by hallucinations, delusions, and can disrupt daily life, relationship, and overall well-being. For its diagnosis, schizophrenia symptoms can vary from person to person but generally fall into two categories, which are the psychotic and the negative symptoms. Psychotic symptoms involve distorted perceptions and thoughts, often leading to a disconnect from reality. So, this includes hallucinations, delusions, and thought disorder. We already know what hallucinations and delusions, so let's just move forward to thought disorder. So, thought disorder is difficulty organizing thoughts and speech, leading to a jumbled or irrelevant communication. Pero sige, lagyan na lang din natin ng examples yung sa hallucinations and delusions. So, sa hallucination, ayun yung ma-experience tayo ng or nakakarinig tayo ng bagay-bagay na hindi naman naririnig ng iba or may nakikita tayo na hindi nakikita ng iba. Sa delusions naman ay yung pagiging dilulu natin na meron tayong belief na hindi naman totoo, tapos wala namang ebidensya, pero pinapaniwalaan pa rin natin. Let's say for example is pasado ka sa subject na to. Huy! Manifesting cherries. And for the negative symptoms naman, this involves loss or reduction in normal abilities such as social withdrawal, emotional flatness, apathy, and lack of motivation. For the negative symptoms, we have apathy and lack of motivation, social withdrawal, and emotional flatness. So sa first one na na-mention, which is the apathy and lack of motivation, ito yung difficulty experiencing interest or pleasure in everyday activities or kumbaga, ayun nga, lack of motivation, wala tayong gana. Then we have the social withdrawal. Ito naman is yung ina-avoid natin na magkaroon ng interaction or mag-engage ng mga bagay-bagay. Kasi we feel like it's awkward. Parang mga introvert lang. And then we have here naman sa last is the emotional flatness, which is yung nililimitahan or kaya naman nahihirapan mag-express ng emotions. So, if merong frequent reoccurrence ng kahit anong two symptoms in 1 month, yun ay sufficient na for diagnosis ng schizophrenia.
Genetics. Genetic predisposition is a significant contributor with heritability estimates around 80%. This suggests that individuals with a family history of schizophrenia are at a higher risk of developing the disorder. Schizophrenia's genetic architecture is polygenic, involving both common variants with minor effects and rare, damaging variants. The neurodevelopmental hypothesis posits that disruption during critical period of brain development can contribute to the onset of the disorder. This disturbance may be influenced by genetic and environmental stressors, leading to alteration in brain connectivity and function. Environmental factors such as prenatal exposure to infections, obstetric complication, childhood trauma, and social stressor have been associated with an increased risk of developing schizophrenia. According to the neurodevelopmental theory, either genes or early life challenges damage brain development in ways that make people more vulnerable to later insults and predispose them to behavioral disorder as early as adulthood. Those who experience challenges before or at a time of birth or during early infancy have slightly increased risk of developing schizophrenia than the general population. Some persons with schizophrenia have modest developmental abnormalities in their brains, particularly in the temporal and frontal lobes. They also exhibit cognitive deficiencies, which is would expect if their frontal and temporal lobes were not fully functional. Parts of the prefrontal cortex take a long time to develop. Early disturbance of such areas may cause behavior abnormalities in young people that emerge as schizophrenia.
The neurodevelopmental hypothesis. Dopamine hypothesis claims that the schizophrenia is caused by excessive dopamine activity. Positive symptoms of schizophrenia are reduced by medications that block dopamine synapses, while positive symptoms are induced by treatments that boost dopamine activity. The neurodevelopmental hypothesis posits that the disorder arises from the disruptions in normal brain development due to genetic, prenatal, and perinatal and environmental factors, particularly during critical periods of maturations. This emphasizes the interplay of genetic, environmental, and neurobiological factors in development of schizophrenia. Treatment. Treatment typically involves a combination of medication, therapy, and self-management techniques, like antipsychotic medications used to reduce the intensity and frequency of psychotic symptoms. The psychotherapy, cognitive behavioral therapy, or CBT can help individuals cope and manage symptoms as well as address secondary problems like anxiety, depression, or substance use. Psychosocial treatments. These interventions help individuals find solutions to everyday challenges and manage symptoms while attending school, working, and forming relationships. Coordinated Specialty Care or CSC. This recovery focused approach provides a team of healthcare providers to support individuals with first episode psychosis.